Well, good afternoon, everyone. Back-to-back meetings, so thank you especially to Ambassador who's just come off the stage. This is our press conference on combating stigma for key populations, very important topic, and I'm delighted to welcome you all to the room. My name is Linda-Gail Bekker. I'm the president of the International AIDS Society. I'm also a clinician working at the Desmond Tutu HIV Centre in Cape Town, and we really care a lot about discrimination and seeing the end of that. Today's topic, combating stigma for key populations, is particularly relevant for me because I've seen firsthand the impact of HIV on communities we define as key populations. So men who have sex with men, transgender people, sex workers, and people who inject drugs. Members of key populations often bear the double brunt of the HIV epidemic. Not only do they experience much higher rates of infection, in too many cases they also navigate punitive laws that discourage them from seeking out the very things they need: HIV information, services, and poor treatment by health systems often are causing them a great deal of distress when in fact should be protecting them. It is little wonder then that an estimated 19% of transgender women worldwide are living with HIV, and transgender women are almost 50 times more likely to be living with HIV than other adults. Sex workers are estimated to have almost 14 times and MSM 19 times the odds of infection compared to the general population across the world. And an estimated 13.1% of people who inject drugs are living with HIV. So no doubt that this is a population who is heavily burdened and really struggle to find the services that they require. There are a number of innovative strategies that we need to find and employ to engage members of key populations in HIV prevention and treatment, and we're going to hear about a lot of them today. When key populations are ignored or stigmatized, HIV spreads, and when members of key populations are given voice, brought into planning processes, and treated equitably, then we know that HIV prevention can flourish. IAS prioritizes key populations through our Nobody Left Behind initiative, which aims to build the commitment of key stakeholders to end stigma and meet the information and healthcare needs of members of key populations. As part of that, I'm also very proud to say that the IAS has its Me and My Healthcare Provider campaign, which celebrates the many frontline healthcare providers who are doing the right thing by delivering quality HIV prevention, treatment, and care services to key populations as well as other populations in their areas. The campaign is driven by members of key populations who nominate healthcare providers who have made a tangible difference in their lives for the Me and My Healthcare Provider Award. We will meet the recipients of that award today. Our panel includes a number of leaders today who are who really make a lot of effort to ensure that all people receive equitable access to HIV treatment and prevention. So, since we do have such a distinguished panel, I want to be sure to leave plenty of time for questions. So I'm asking that everyone keep their comments as brief as possible to 2 or 3 minutes, and then we'll go to question and answer. So first off, my great pleasure to bring someone who I know cares a lot about this topic, Ambassador Deborah Burks, leader of the United States government's PEPFAR program, who will share her insights on the role of key populations in getting to zero and on the activities of the USAID and PEPFAR-funded Linkages project, a very important project which is dedicated to serving key populations most at risk of HIV. Over to you, Ambassador.
Great, thank you. And I think the biggest thing we've done over the last 3.5 years related to key populations is ensuring that we're tracking both their prevention services and their clinical cascade to really point out where we're having difficulties. And it was when we started doing that in very clear detail at the national and at the district and lower levels, we could really see the amount of impact layered stigma has on key populations and their ability to access for both prevention and treatment services. And I just want to start by applauding ViiV and IAS for having these awards and recognizing the importance of the healthcare delivery system and recognizing that it's nurses, it's social workers, it's pharmacists who all have to work together, who interact with our clients where it has to be a positive, welcoming experience. And we know from studies that we have funded in Jamaica that there's a real issue in some cases with the healthcare delivery system. And I think what we sought to do with linkages and the support between USAID and linkages and PEPFAR is to really bring those issues to the forefront and really look very clearly on what are the issues and what's the issues at the health service delivery sites and what it takes to reach those that are most stigmatized, most in the shadows. And I think linkages has really shown us, and we've been told this by communities from the beginning, that you need to work within the community and the community of the key populations. And using peer-to-peer outreach and work has really made a significant difference over just the last 3 years. And we still have work to do. We know from the Key Population Investment Fund, which is focusing on increasing those services, both prevention and treatment services, that we need, and we recognize the need for more work there. But we also recognize the need that governments and communities have to have a very frank conversation about the public sector and the access to care. I was on the stage talking about HIV and global health, and they talked about, one of the senior scientists from Malaysia talked about the issues that they have at the policy level and at the government level to really recognize the disconnect between supporting population, ensuring access to services, and the politicians and access to funding. It is not a mistake when you look at the UN AIDS report that every place where there is what we used to call a concentrated epidemic, every place where there is an epidemic that is primarily in MSMs, IVDU, people who inject drugs, sex workers, all of the marginalized groups. If you look at it, you see testing is less, treatment is less, viral load suppression is less. And so that's a wake-up call for all of us that the next 24 months really need to be about making sure that everybody has equitable access.
Thank you. Next, we'll hear from Manuel Goncalves, Head of External Affairs and Communications for one of IAS valued partners, and you've already heard they're very much involved in this part of the IAS's work, that is ViiV Healthcare. Manuel will speak about the role of the private sector in overcoming stigma and discrimination, and will introduce the winners of the IAS and ViiV Combating Stigma and Discrimination in Healthcare Settings Award. The award aims to scale up proven action or encourage new innovations that reduce stigma and discrimination in healthcare settings. Over to you, Manuel.
Thank you very much, Linda. As a representative of the private sector, and namely a pharmaceutical company, we are very much aware that our mission does not end in inventing and developing new therapies for people living with HIV. Because even if those therapies are available, if people continue to suffer the stigma and discrimination that society, but even more particularly in the healthcare setting, and being a former practicing physician, I know that I can speak this is true. This is not a myth that people suffer. We will continue to have people that will not get into care, that will be lost when they are in care, or they will not adhere to their treatment. So we want to walk the talk. That's why we created this Positive Action Challenge with IAS. And I'm very happy to have in the room today the winning organizations from the Positive Action Challenge on Stigma and Discrimination in the Healthcare Setting. The innovation combines a true research-driven approach to train and sensitize healthcare providers on sexual orientation, gender identity, sexual health needs, and HIV service to reduce the stigma and discrimination that affects, as I say, people living with HIV, but particularly the key affected populations. So I'm very happy to have with us here in the audience the winning organizations who travel from Vietnam, from Lighthouse Social Enterprise, Mr. Don Tang Tung, and from G-Link, Mr. Lee Min Tan. But I would like also to finish with one thing I think is extremely important. Companies have to walk the talk. So that's why inside our company, we are very much conscient of the need of having inclusion policies, inclusion on diversity, including key populations. We have a very active LGBTI community that meets with very senior people and that is manned by very senior people in the organization. Because if we don't walk the talk inside our organizations, it's very difficult for us just to give a prize. I don't think it makes sense to give a prize and then don't have inclusive policies. That is a challenge as a member of the private sector to everyone in the private sector to walk the talk on this.
Thanks very much, Manuel. And again, congratulations to the award winners. We hope that many other organizations will compete in similar fashion, so thank you. Next on our panel is Ifeanyi Orazulike. Ifeanyi is Executive Director of the International Center for Advocacy on Rights to Health and is the chair of the Key Population Committee in Nigeria. He will share some of his experience and perspective on reaching key populations in challenging environments.
Thank you very much. It's quite an honor and a pleasure to be here, and thanks very much, Debbie, for your commitment to ending AIDS and also supporting key population. And dealing with stigma and discrimination in the Nigerian context and also within the key population context, it is a multifaceted national approach to HIV and stigma for key affected population in tracking KP health issues from national, regional, state, and local government perspective. There is need to increase the capacity of healthcare workers, but beyond healthcare workers, also looking at stigma and discrimination and monitoring it from the community and service receivers beyond service providers, which is very, very critical. And one of the things we have done in our facility is to begin to collect and feedback from community members who have begin to come to, who come to access services in the clinic over time. How was your service? We've provided a suggestion box. Tell us how you feel. Make it very anonymous. We don't need your name, but we need how you were treated. Would you want to come back next time? Are you able to come back willingly without being followed up? Because this is one of the things that needs to happen. We need to begin to look at how we can encourage community and also strengthen community capacity to begin to take ownership. When communities begin to take ownership, we deal with a lot of issues, issue of stigma and discrimination, issue of infection rate, issue of the epidemic. We are able to control the epidemic, like I said over and over again, getting community buy-in and ownership. If we talk about community engagement, it's beyond condom and lubricant. And I will say this over and over again. Our lives are beyond condoms and lubricants. Our lives are beyond taking pills. We need life-changing capacity building. Beyond sitting us down and training us on how to distribute condoms, there are skills that people want to learn. I've seen people who have worked as peer educators for the last decade. They want a change in their life. And when people are empowered, they are in a better position to make informed consent and also to make informed decision about their community. People would learn to take ownership. But this happened at different levels, and there's need to begin not to also do one size fits all for all the regions, but also to look at the context of every region, what works. We need to begin to adapt what works. There are lots of best practices around the globe, around the regions, and we need to begin to look at what is community doing. What has community learned in the past, in the last decade of providing training, providing capacity building? What have we been able to do? What lessons have we learned? How can we build on the lessons we have learned? Very, very key and critical in delivering HIV services. And also reforming laws and regulation. Very, very important. There is also need to begin to change the hearts and minds of the general population towards key population. There are self-stigma. We also have double stigma. You are stigmatized because you're a gay man. You're stigmatized because you're a sex worker. You're stigmatized because you inject drugs. And then again, you're also stigmatized because you're living with HIV. So it's beyond. I was talking to some of our government workers the other day, and they were like, "Oh, what's so special about gay population? Why can't they be treated like the general population? It's the same thing everywhere. You don't need to go to the doctor and tell people that you're gay." Hell no. You should be able to tell the doctor that you're gay and you have sex differently. And they are able to deal with we have issues of anal cancer, we have issues of anal warts, which are not common within the general population amongst men. So we have different and unique issues that need critical and proper attention to end AIDS, to control the epidemic, and also to reduce the infection rate. Thank you very much.
Thank you very much indeed, Ifeanyi, and thank you for sharing some of your own experiences there. Finally, we hear from Neo Nemetso Manapula, one of this year's Me and My Healthcare Provider awardees, and a warm congratulations to her. Neo is a social worker at the Nkaikela Youth Group in Gaborone, Botswana. She's receiving the award for her work in supporting ARV adherence and addressing the multiple daily living needs of a client base that includes young female sex workers. Over to you, Neo.
Thank you. I work at Linda-Gail and I'm Neo. I provide KP compliant services. By KP compliant services, I mean I ask, where do you want to access your services? Who do you want as your provider to KPs? And how do you want to access those services? Or how do you want the services to be provided to you? I also provide psychosocial support to sex workers. I tell you, it took one sex worker to convince me or to come up with their issues. At that time, I was still at Ministry of Health. I didn't understand. So that sex worker was pleading for STI screening, so that Ministry of Health can provide STI screening for all the sex workers that she knew. So that story touched me as a provider. And, from that moment, I knew that, I was at the wrong place. Mm-hmm. I need to work at the community, to serve the community. And these are the kind of people that I want to work with. And for me, it has been fulfilling as a social worker to work with sex workers because they are open. They are people, as anyone else. And also, I like saying they are mothers, they are sisters, and they need to access services like anybody else. Apart from that, I do sensitization workshops for healthcare providers who are naive, and I also put a face to sex work. All the time, I bring with me a sex worker to say, can you come and share your story so that sex workers can learn from you, so that healthcare providers can learn from you, and they can better how they give you services. And to date, I'm proud to say I have 159 sex workers who are enrolled in ART, and I make sure that all the time I ask the nurse prescriber, who is coming for refills, when, so that I can make follow-ups. I make sure that I follow these women at their homes so that I can see how they are doing. I assess other needs apart from health, so that I can link them to other services that I don't provide. And there are challenges in Botswana. The law does not support sex work, and this makes them to go in hiding even more, and it makes them to accept violence, because they can't go to the police. And another challenge is that healthcare providers, they are not willing to change their attitudes. Some are. If you put a face to a sex worker, if you get a sex worker to tell that story, some healthcare providers will come forth and say, I didn't know this was happening and all that. And I always tell them that you don't know who your client is. A client is our man in society. So if you don't give sex workers services, then who are we protecting? Hence, I go with the slogan that says, sex workers' health is the nation's health. And I would like to thank International AIDS Society for this opportunity, to thank linkages, to thank USAID PEPFAR for funding our project and making sure that we give best services to sex workers. Thank you very much.
That's great. Thank you, Neo. And I'm sure you agree, she certainly deserves her award, and thanks for being here today. We're pleased to have 2 additional Me and My Healthcare Provider Award recipients with us today in the audience. Maybe you can give us a wave and see where you are. Louisa Ang, I'm hoping is here. Yes. Hi, Louisa. She is the Provincial Installation Pharmacy Manager of the Provincial Health Office, Papua Jayapura, Indonesia, and has been recognized for her efforts to ensure consistent and timely access to antiretrovirals for a patient population that includes people who use drugs. So thank you very much indeed for being here. Congratulations. And Stella Shege. Hello, Stella. Congratulations to you too. A nurse counselor at the Minority Persons Empowerment Program, she's been recognized for providing quality and compassionate healthcare to a client base of MSM and male sex workers in Thika, Kenya. So congratulations, very nice to have you today. I'm now happy to invite questions to our panel. Please go ahead. We have 2 microphones if anybody would like to ask any questions of the panel. Yes, if you come along here, just tell us your name and the institution you represent and who you're directing your question to.
Okay. Thank you so much. My name is Sharon Kavu. I'm from Zimbabwe. My question is directed to Nia. That's an interesting topic you've just presented. I just wanted to know if there is anything you're doing for these sex workers to make sure that they protect themselves, because I understand they may meet clients who are violent, and are you doing anything to protect them so that for their own safety, especially considering the fact that it is not allowed in Botswana, so for them to report a case, it may be a challenge. And also, is there anything that you're doing for these sex workers who are not living with HIV? In terms of maybe prevention and the issue of PrEP, and is your team or the people that you work with also doing other programs with other sex workers within the SADC region, probably to share experiences and ideas on how best the sex workers can live in the country? Thank you.
Thank you. No.
Thank you. Yes, in terms of protection, we give them, tips on how to protect themselves, and we also do sensitization for law enforcement officers. Even though the penal code does not protect sex workers, we do sensitization for police officers, and I also do accompanied referrals to police officers. We have identified one gender focal person and in the police station where we work, and we also do, we make sure that, they get privacy so that they can report their cases and, get help. There are those police officers who even call the client because we are there and say, this sex worker said you didn't pay her. Why can't you pay her? So, and they get paid. In terms of sex worker, what we do with HIV negative sex workers, PrEP is new in Botswana. It's something that is new, and there are talks. We are part of those talks with Ministry of Health through UNAIDS, and we are hopeful that we'll be able to. We have already started sensitizing our sex workers about PrEP. So we are hopeful that once it starts, then they will be able to, to access it. The only problem that I always say at that meetings is that there will be, they want them to buy, and if you want a sex worker to, to buy, on top of taking care of her kids, you are asking her to do more sex work. So I'm always, advocating that is there anything that can be done, in terms of, paying for PrEP. And in the region, we are part of the coalitions. Yes, we learn from others, and we always talk about how we can improve our programming with other colleagues in the region. And I also have to point out that we have migrant sex workers and they can't access ARVs. So we are always trying to talk, especially with our colleagues in Zimbabwe, to see how best they can get services that they cannot access in Botswana. And one other thing is that I always sensitize healthcare providers that they're not immigration officers. So if a sex worker comes to your clinic, you took an oath that you are going to serve, people. Why are you looking for her days? Because you are not an immigration officer. If she has a passport and you can put her face and say, this is this person, why should you start asking that you are given 3 days and your 3 days has elapsed? So, we do this work passionately so that these women can access services.
Wonderful. I feel the passion. I hope you do too. Congratulations. So I'm going to, on behalf of our international viewers, ask a question as well. So, Ambassador, I know how passionate you are about metrics and tracking the various indicators that are so important to our epidemic. How are we doing on the stigma and discrimination side, and how are we actually tracking that? I know it's a tough one, but I was just wondering in terms of where PEPFAR is thinking along these lines.
So I think that's a really great question. So we've been adapting the UNAIDS Stigma Index to really, and requiring it to be done in every country. But I think we started with our own staff, because I think when you want to say to the government, you need to train your staff and sensitize your staff to the unique needs of different key populations, and they're very different in their needs. We had a sensitization training for all of our staff in all of our countries. Over 3,500 individuals were trained at headquarters and around the globe on the issues were uniquely around key populations. I think we're looking at how do we continue that sensitization. We heard amazing stories, and now it's a matter of translating those stories into numbers. But we had some of our local staff say to me, say to the trainers, they hadn't spoken to their brother in 10 years because he was gay, and now they understand. So I think we can't come to it, and we have to give people the benefit of the doubt that they may not have had the training they need to really respond in the correct way, and then we have to provide that training, and then we have to follow up with stigma indexes, and we have to do what you talked about, having people meet people at the clinics and ask them. We do that with adolescents, and we do that now with many of our key populations, because a lot of people say they're doing a great job, but that's not really the indicator. The indicator is whether the client believes they're being served well.
Indeed. So Manuel, Me and My Provider initiative sort of really picks up on this. Let's ask the individual which provider they think is important. What are you hoping will really be achieved by that sort of program and that campaign?
Well, we would like very much is that people that a key population or anyone either living with the virus or want to have access to learn about prevention feels that they are reaching for a safe environment where they are not discriminated, that people not starting interrogating different because they are a key population about habits, about beliefs, about preferences, either on gender, on sex. That is the way, because in reality, what we find in the healthcare setting is very much translation what we find in society. I truly believe that nurses and doctors, we are both doctors, we were not born with an idea of stigmatizing people. This is how society creates. So, but we have to be very much aware that we have an obligation, an extra obligation, everyone in society has. But we have an extra obligation when, in the healthcare settings, when people are asking for support, that they find a safe environment. I think it's important when I said that, and I'm very happy what Ambassador Burks said about the training of PEPFAR staff, is how we consider that in companies, in schools, we have to start doing the work with our people. It will not make sense for me working in a company that supports community-based organizations in advocacy programs, fighting stigma and discrimination, and then not bringing that discussion inside the company, taking for granted that people were not stigmatized and discriminated. So we are very much aware. We make sure that we have internal programs where I can tell you we have with charities, we bring people that have lost their jobs due to living with HIV, we bring them to help them being back in work, helping them to find jobs. This is, we consider a major obligation, but it's also a way to, inside the organization, reducing eventually the stigma and discrimination. So this needs to be very coherent type of approach.
Thank you. And I think we're coming to the end, but I'm going to ask Ifeanyi to have the last word. Do you think we're making headway in your country, Nigeria, just as an example, in this regard?
Well, I would say we are better than 10, 15 years ago. But even though there's a lot more that could be done, because 10 years ago we didn't have a clinic, but now we have one of the biggest MSM clinic in the country providing services. And it's not going to be 2-3 days training is not going to be enough. It's going to be a continuous process to begin. Like someone said that you imagine how much it takes for our parents to accept who we are and then to come around. Don't expect a different answer from a healthcare provider. So it takes as much time as it takes, because we're all human beings and which deal with things at different times. But one important thing is we are first of all human before we became who we are.
Indeed. Thank you. Great note to end on. And thank you everyone for being here. I do want to thank our panelists for being here. Congratulations again to the award winners. We're very proud of you. And we look forward to interacting with you more as the year goes on. So good luck and thanks to everyone.